when I was 20, if somebody told me, hey, Neem, it's okay to fail, that would be awesome. Because at 20, all we do is, oh my God, I don't want to fail. I don't want to fail. I don't want to fail. I want to succeed at everything. If I knew that at 20 and failed and somebody gave me the autonomy to fail, it would have been a great learning and development for me.
I'm Shannon Lucas.
And I'm Tracy Lovejoy, and we're the co-CEOs of Catalyst Constellations, which is dedicated to catalyzing innate change makers to accelerate positive change.
This is our podcast,
Move Fast, Break Shit, Burn Out,
where we highlight catalysts that are creating amazing change in the world. I'm super excited today to connect with Nimesh Jhaveri, President of Community Pharmacy and Health, Senior Vice President at McKesson Corporation. He and I connected way back when I was at Cisco Chill, looking about how we could reinvent the patient experience around oncology. He joined McKesson in 2018 as SVP and President of Health Mart. Previously, he led healthcare services for Walgreens, where he spent 29 years in various business development leadership roles. He's a frequent speaker at industry events, including TEDx, and I'm so excited to reconnect with you today.
Well, thanks for having me, Shannon. It's wonderful to see you.
What a journey you've been on. Well, let's start by understanding how you relate to the concept of catalyst.
Well, first of all, congratulations on the concept and what you're doing.
Thank you.
I think it's terrific. Catalyst to me is about forming the future, right? It is about creating a different, better future for the public, for healthcare, for any industry you're in. That's what it's about, right? It's not about status quo. It's not about being satisfied with what we are today. It's about improving. And the word catalyst, even just saying it, conjures up excitement, conjures up a sort of a will to do something. And I think that's where I get very, very excited about the work that you're doing.
Thank you. And I've seen you transforming your industry both from up close and afar. So why don't you tell us, what are you working on now? What are you catalyzing these days?
Well, I think the biggest catalyst that we can do and what we're focusing on, me personally, I'm a registered pharmacist as well. And so I'm still licensed. I can still practice pharmacy. I'm sure I can probably have some advice, but probably outdated. But
I didn't know that about you. That's an interesting tidbit. That's really fascinating. Yeah,
I know. It's something that I'm very proud of as a clinician, someone that has been at the bench, taking care of patients after I graduated, and that stays with me all the time. But what's really amazing, what we're working on, when I graduated pharmacy school and years past before that, the focus was about patients walking into your drugstore, walking into a pharmacy and picking up their medication and getting some consultation from the pharmacist. What we're trying to do is to shift that. It's not about the prescription bag or the prescription drug anymore. It's just as important, but it's about the healthcare that surrounds it. It's about putting truly that patient in that center and having a pharmacist be I hate to say it, a catalyst to help them stay healthier, get well. It is not simply about taking your medication every day. It is about shifting them to saying, hey, let's change your behavior and how you eat. Let's change your behavior and how you exercise. Let's change your behavior and how you eat and how much you eat and what you eat. All of these things, for a pharmacist, it comes natural and they're at their corner, right? I don't know if you know this. I'll throw this statistic out for you, Shannon. But 90% of the U.S. population live within 5 miles of a pharmacist and a pharmacy.
I did not know that.
They are so accessible. Go in there, ask them questions, take your medication, and get the help that you need. That's what we're really working on.
I didn't know that about the 5 miles. And I'm curious then about the rest of the population that's not within that access, and how do we support those people?
Well, that's a great question, and there are catalysts all over the profession right now. We're shifting towards a digital model as well. So whether you're a retail pharmacy or an all-in digital player in the pharmacy space, what we're providing patients is the ability to connect with that pharmacist or get their medication delivered to home, whatever the case is.
Mm.
but having that access through technology. And that's an important facet of healthcare and pharmacy. Yes, you have the pharmacist there, but let's connect it with technology to help patients really be even closer to them.
It's amazing. So what were some of the challenges, like as you've had this vision for how you want to transform that relationship with the patient, particularly I'm guessing during the COVID years, it became even more important, that role that you guys played in that ecosystem. Yeah. What was that vision like, and what were some of the challenges as you were going about that?
The biggest challenge, believe it or not, is sometimes our own selves, right? We have to have an inherent inspiration and motivation to change. Right. Sometimes we get caught up in, well, this is what we've been doing, and so that's what we should be doing going forward.
Yeah.
And that's probably the biggest barrier, is to get all of us to start thinking about the profession and what we do in a future stance, in what we need to be doing, not what we are doing today. And so I think that's one of the barriers. Of course, regulatory is always a barrier. Helping our legislative leaders understand what pharmacists do, what they can do, how they can do it, how accessible they are, connecting technology to them. That's in itself a big chore. And then the last is getting patients to understand what they do, right?
Yeah.
And they can walk into that pharmacy, get their questions answered, get their medication. Nowadays, Shannon, you can even get your, blood drawn and labs tested. You can, go in and see an NP. In some cases, you can get your hearing checked. I mean, there are so many things that you can do at a pharmacy that doesn't require necessarily an appointment. It just requires a little time and a little inspiration on yourself to go in there and talk to that pharmacist.
It's amazing. So, I mean, one of the biggest challenges for Catalyst is the stakeholder management. Like, you have this vision of the future.
Yeah.
They're like, but we've always done it this way. And people have different relationships with change, both on the internal, the regulatory, and the patient side. So how do you manage bringing all of those people together towards that new, better future that you see?
Well, I think you got to first articulate the inspiration, right? You got to articulate the vision. People gravitate towards a vision that they can be inspired by, right? That they can see that it's not just pie in the sky, but it is a better future for everyone. I think that's the first thing you got to do. And then the second thing is get some champions, get some folks that are leaders in the industry to say, you know what, that's a good vision. We need to go after it. Help them to start to champion and start to do it, so they can show and demonstrate what they're doing. I think those are some of the things that you want to start to do quickly to get all these stakeholders together.
Yeah, you certainly can't do it alone, right? And so it's like finding that the first coalition of the willing to go on the journey with you. What are you most proud of in terms of what you've accomplished in that sort of systemic change that you've been working on in the past couple of years?
I think, it goes without saying that COVID-19 was absolutely horrendous for the entire world. The lives that were lost, the families that were changed forever. But within all of that, there was a glimmer of light, of hope, which was our healthcare professionals, and specifically, in my case, pharmacists. 2 out of 3 vaccines for COVID-19 were delivered by a pharmacist in our country.
Wow.
And they continue to do that. I think one of the things that I'm probably most proud of is how resilient the pharmacy profession was and how they stepped up for this pandemic that we had to go and solve quickly. That is a very proud moment. And what's interesting is I spent some time with, of course, CDC and HHS over the last couple of years throughout this whole thing. And whether it's a chain pharmacy or a grocery pharmacy or an independent pharmacy, I'll tell you a great story. All of these folks came together, 19 different pharmacy teams, companies, organizations came together, worked together for the betterment of people and the country. And that to me is hugely a proud moment for all of us. And then the independent pharmacy space, it's interesting. Most of those are located in socially vulnerable areas, areas where there isn't a large chain or a mass merchant. It's those small mom and pop drugstores that have been there for generations, that are taking care of those communities. And they played a huge role in making sure that we have equitable healthcare in the country. That's what I'm most proud of. I get very passionate about that because, when a pharmacist can deliver on that promise of providing good healthcare, it's awesome. It's just exciting.
It's amazing. I mean, when we think about some of the biggest problems facing society today, it's going to take that kind of the ecosystem approach coming together in service of that vision, that inspired vision that you're talking about. So I hope that we can capture that shining example to share with other industries, or even that same industry and other sort of challenges that are facing us as a country.
Absolutely. And I hope people take that as inspiration, because before COVID-19, pharmacists didn't have some of the things that they were able to do during COVID as part of their scope of practice. And so we were able to champion the reason for why they need to have that, being accessible, being in the communities, knowing those people, and quite honestly, they have the training and the education. And so, I give our government also a lot of credit for allowing that to happen. Now we got to continue and take that and use that as a catalyst for even more change.
Yeah.
Right?
So that was going to be my last question on this thread. So where do you see the momentum of everything that you've done going? Do you have a next vision that you're working on?
Absolutely. We are working on pharmacists being able to provide test and treat options for patients, continue to expand their approved vaccination, the vaccinations that they can provide. We're trying to get them to be a full provider and receive that provider status, just like a physician or a nurse. And to me, there was a recent FDA guidance that allowed pharmacists to prescribe with some caveats for Paxlovid, and I think that's just a start. And so we're going to continue to push that. We're going to continue to educate the population and the legislators to say, hey, give us the opportunity. We can take it and we can do it.
Well, and as I was mentioning to you earlier, I just want to say a big thanks for your role in helping to make that happen. As having a mom who's immunocompromised and knowing that she might have access to that more readily, it's massive. What you're doing is materially impacting people's lives in so many different ways. So thank you for your great work. And I'd love to introduce you to Tracy, my co-CEO.
Hi, Tracy.
Hi, Nimesh. Thank you so much for being here with us.
Well, thanks for the invitation.
I'm gonna jump us in. I have a follow-up that will bridge us into rapid fire. Getting to look at your amazing, LinkedIn, 29 years at Walgreens, where each role in the pharmacy world just built on the other, and then getting to see the work that you're doing at McKesson. Getting to hear you live, your enthusiasm is palpable. And I wonder, what is it that keeps you so deeply passionate and connected to this work?
Yeah, Tracy, thank you for that question. And, it's the ability to make a positive impact for people. It sounds really hokey to say that, but I jump out of bed knowing that I can do that. I may not be able to do direct patient care, but I know that in the decisions that I make with my teams and the folks that I work with, that's what the goal is, right? It's to improve someone's life. A mom, a dad, a son, a daughter, all of those folks that received a vaccine in one of our stores, in a pharmacy, you know what? That made someone's life better. And not just for them, but for all of the folks that lived within their household or they came in contact with. That gets me excited. And, I think if all of us can just get up in the morning and say, I'm going to make a difference in one person's life today, just as simple as that, I think we'd all be better off. I think our world would be better. It'd be kinder. It'd be gentle. It'd be for the right good. And I think that's what gets me excited.
Well, thank you for the gift of the energy you bring in that answer. And it ties directly into the next question, which is, what type of advice would you have for other catalysts out there? Said another way, what do you wish you could tell your 20-year-old self? And I'm guessing that would be one piece of it.
Yeah, that would be one piece of it is never lose your passion. But I think when I was 20, if somebody told me, hey, Neem, it's okay to fail, that would be awesome. Because at 20, all we do is, oh my God, I don't want to fail. I don't want to fail. I don't want to fail. I want to succeed at everything. But I will tell you, if you fail, if I knew that at 20 and failed and somebody gave me the autonomy to fail, it would have been a great learning and development for me. So that's probably the one thing I'd say.
What would that open up for you at 20 years old, that it's okay to fail? What might your path have looked, how might your path have looked different?
I think I would have gained confidence in being a change agent faster, right? I would have been able to say, you know what, we're going to throw 10 darts and 7 of them are going to miss and 3 of them are going to hit, but I'm okay with that because those 3 are going to change the world. Those are the types of, things that I think we have to instill in the younger generation. It's okay. Throw some darts. And if they miss, don't worry about it. Because when you hit them, boy, it's going to be right.
That's so empowering, right? There's so much liberation. And I don't have to know, I just am allowed to go and try some stuff. Yeah. And to hold that idea of, I just want to, make a difference in one person's life today. I don't have to get up and change the whole world today.
Exactly.
Whew, I feel liberated and I get to do this work every day. So thank you.
Well, you guys have a fantastic work that you guys do. I need to be with you both every day.
I know. This can be our stand-up every single day. We'll get it on the books. So what advice do you have for leaders and executives out there and in finding and leveraging their catalysts and folks like you?
I think, I would say executives need to lead by example. And I'll tell you what I mean by that. Myself included. A lot of executives will tell their teams, fail fast, succeed faster. But I think what they need to do is not just speak with words. I think they need to be real with their folks. They need to be vulnerable. It's important for executives to show that vulnerability, share their failures, their mistakes, and then ultimately the success that they've attained from them. By simply saying, hey, fail fast and move on, that sometimes doesn't resonate. Be upfront with your teams, be upfront with your folks and say, look, here's the 10 mistakes that I made during my career. And here's what I learned from them. So if you make that mistake, it's okay. I got your back.
I love the thread you're pulling on there. One of my favorite things to do, I love to read biographies. And something I love about reading about Gandhi, about reading about, oh gosh, I'm totally blanking on her name. None worked with Princess Diana. Anyway, it's going to come back to me. But the idea that we hold these people that have changed the world in esteem as if they did it in a single day.
Yeah.
And when you read their stories, and with Gandhi, for example, you see it literally he walked miles every day to his destinations. Yeah. And I love that as a metaphor, as if it's one little step at a time with 1,000 fail points in what he tried to put in place. Right. And so as an executive, to not just be yep, I'm the CEO and I'm awesome and we're going to build a culture of failure, but to show this is what it takes. And this is what failure is. And these are my failures. And this is how it feels every day, even though my title is CEO. I love that call to action. That's fantastic. And it makes it so much more tangible than that value of fail fast.
Yeah.
Thank you. That's so
good.
good.
I think, that term fail fast sometimes can get, overused if it doesn't mean anything, right? I think executives, we say things like they have to be authentic. They have to, have empathy. But the only way to really show it is to show your vulnerability. Yeah. When you weren't authentic, what happened? When you weren't making a mistake, what happened, right? Share that with your team, share that with your folks. I think that's more powerful than anything that you can say, or try to inspire. Tell them by your own experiences of what has happened.
Yes. I love it. I love that. you're creating a recipe book for vulnerability that I think is inaccessible to a lot of people.
Yeah.
So,
And you know what? Executives don't have to be always tough. I think that is a past phenomenon. I think that is completely outdated. I think executives need to be caring. They need to be empathetic. They need to be vulnerable. They need to show, heck, if it's okay to even show your tears. That's what good executives ought to be.
It's like showing what it means to be human.
Yeah, for sure.
And do great things in the world.
Absolutely. Absolutely.
So what's the worst part about being a catalyst?
And that's a great question. I think the toughest part about being a catalyst at times is you have to learn to inspire yourself, because you're the inspiration for others. You're getting everybody fired up and getting going, right? And it's hard, right? When you're alone in your office or in your bedroom or in your car driving, and there isn't anybody around you to inspire yourself. How do you do that? And you asked me a question, what gets you out of bed, right? You got to have that candle burning always inside of you that inspires yourself. I think that's the hardest part.
How do you do that?
Just keeping that one focus in mind, right? Which is I'm here to make a difference. I'm here to help others make a difference. And if we can, in my world, change healthcare on the way for the better, home run. Let's do it.
I love how you're flipping the script and so many things in my head. That was beautiful. All right. So celebration, what is the best part about being a catalyst?
I think, the best part is simply the ability to mold the future, right? It is, there is nothing, Tracy and Shannon, that is more exciting than to touch something and say, you know what, that's going to blossom into something better for others a year from now, 5 years from now, 10 years from now, whatever it is. And I'm going to leave a lasting legacy of good for the world. How small? It doesn't have to be, Steve Jobs level. It could be a small little thing in your own world. That's okay. But I think that's the best part about being a catalyst, is knowing that you hold the hand to go change the future. Go do it.
Mic drop. Yes. As we wrap up today, what are any call to action for our listeners that you'd like to leave us with?
Yeah, I think there's a couple. So I'll talk one for our profession, back to the pharmacist. As a pharmacist, here's what I would say to everybody. Go stop by your pharmacy and go say hi to your pharmacist. Here's why. Because when you need him or her, you'll know them. Go develop a relationship with them. Believe me, you won't be sorry. That's one. And then secondly, doing good business by doing good is a really great thing. Go do that. Go make the world better. Don't fight about politics and all of these other things. Focus on what matters. And so my call to action to everyone, please figure out what you can do that's good for the world and go do it. Don't wait for somebody to tell you. Be that catalyst, in your words, and go shake it up. I think you'll be happier for it, and the world will be happier for it.
I am just soaking that in. Yes. That to everybody. Can you imagine what it would feel like tomorrow if that's what people were doing? Oh, yes. It is such a joy to have gotten to not only listen to the stories that you're sharing, but to feel the energy you bring. Truly, that has come through the video for me. So thank you so much for that. And typically, we'd end by saying, like, thank you. We're going to watch you continue to disrupt the industry. But I love that as I hear you talk about the shifts in pharmacy and getting connected with your pharmacist, it's much more about building connection and about, kind of like you said, helping one person at a time and bringing healthcare local. And while that's disruptive, it feels so gentle.
Yeah.
And I want to thank you for that, because I think that as catalysts, even Shannon and I kind of, at the spearhead of this, we can talk about it as in aggressive terms. And I love this kind of wave of make the world good.
Absolutely, Tracy. And I want to thank you both. This has been amazing. I get energy from the two of you, and it is fantastic. And I'll leave you with this last thought of thinking, right? During the last 2 years, during the pandemic, we could have all asked for another iPad, another technology, another car, another TV. Here's the one thing every single person in the world yearned for: to be able to touch another human. Go do that.
Make me cry.
Definitely. Oh, yes. I'm going to go hug my kids in 5 minutes.
That's right.
That's
right.
Yeah.
I love
I'm giving you guys a virtual hug too.
Thank you.
Oh, right back.
at you.
Back. Yes. Well, to our listening audience, thank you so much for tuning in. And if you'd like to learn more about how to accelerate positive change, go to our website at www.catalystconstellations.com.
And of course, be sure to check out our book, Move Fast, Break Shit, Burn Out. And if you have other catalysts in your life, hit the share button and send a link their way.
Thanks again.